Email. Let me do that. I'm going to try to say by email, no, but I thought I should do it all.
Okay. Ike
2003
at yahoo.com.
Yahoo.com. Okay. All right. So send.
Ó dàbẹ̀ ní pé ẹni tí bí yẹn náà máa tó rí sí.
I'll send it again.
Okay, thank you.
So
let's just give the IT a few minutes to share it.
Oh, let's do one more. So they tell you rí screen mi tó ń gbé Zoom jáde. Ṣé Zoom ni mo ní kó wò?
Hello, sir. Hello, sir.
Yeah.
Mutiri. Yes, sir.
Okay.
I will download it. I will download it and share it now.
Okay. Mo pé kinní kan ló yẹ kí n tẹ̀ tí mi ò tẹ̀ ń bí báyìí.
Then happening, you just let us, you will, how do I put it?
And I will, that person should follow me.
What? Yes, sir. Prof?
The person you need to follow me when I say next.
Yeah, I'll follow you. I'm with you.
Okay.
Can you hear me now?
Yes.
Yes, I'm with you. I'll follow you.
So, okay.
Yeah, I'm working on it.
When you have been introduced, Prof, you will, your video should be on.
No problem.
That way at that time. Okay. Or it can be on right away, actually. So that we can focus on you when your profile is being read.
No. Once you want to start.
So the IT, are you ready? So we can start.
Just give me a few minutes. Like 2 to 3 minutes.
Okay.
Yes, ma'am.
I will say that could you stop recording and start all over again so that Google conversation you only see no.
No problem, I will do that now.
Okay, thank you.
Let's look in here. It would be easier for me to control from here.
I will work with you, sir. I will work with you.
Okay. All right, okay.
torí pé òun ò fẹ́ kí òun fẹ́ fi bẹ̀ ṣe stop.
We have not seen the screen, no.
Wọ́n ó ní pé wọ́n fẹ́ fi additional security door saying front. Can we all mute, please? Please mute. Please mute. And technology, IT.
I'm with you, ma.
So, are you ready? We want to start.
Almost. Just give me 1 minute more. I'm trying to download the file.
Are you sure everything will be okay? So we can start the preliminary.
Yes, sir.
But you didn't stop the recording. Would it not affect?
I've stopped the recording. I will start all over again.
I can see recording still on. That's why.
That is the recording is on the cloud. The one I'm recording on my system is a clearer version.
Okay.
Yes, ma'am.
So we can start now.
Yes, ma'am. So I'm starting.
You said 1 minute. We don't want any break again, please.
No problem, ma'am.
Or you want us to wait till you are set?
Okay, just give me 30 seconds.
Okay.
All right, ma'am.
Okay, the version.
How are you?
You can start, ma. I'm ready, ma.
Okay. Thank you very much. Mr. Adeniji. Sorry, Dr. Adeniji. Dr. Adeniji. Dr. Adeniji.
We're sorry for the delay. Yes, ma, I'm on, ma.
Are we
Once
recording?
again, we are sorry for the delay. It was due to... Yes, ma. Can you hear me now, ma?
Yes, lecture. Yes, hello? I want the IT man to confirm we are now recording.
Okay, I will start the recording now in the next 5 seconds. 5, 4, 3, 2, 1.
IT, can you mute everyone except those who are speaking? Please mute everybody except those who are speaking.
Hello, I'm on, ma. Good afternoon, everyone. You are welcome to the July edition of IAMRAT lecture seminar series. Sorry that we are starting a bit late. It was because of a technical hitch. Let me, first of all, as usual, give us a brief background of the Institute for Advanced Medical Research and Training, IAMRAT. The institute was established in 1980 as one of the academic divisions of the College of Medicine, University of Ibadan, primarily for coordination of multidisciplinary research programs in the college. It is in response to redress limited institutional capacity in Nigeria for strengthening training, research, policy development in the area of health. The institute has a track record of research of international standard channeled towards relevant local and global health problems. This will have complements of trained staff with expertise in many fields of studies, like virology, epidemiology, biostatistics, cancer research, infectious disease, drug research, genetics, virology, molecular biology, neuroscience, and aging research, with several grants have been won from many renowned organizations. The Institute has numerous research and administrative units, among which are the following: genetics research unit, drug and cancer research unit, malaria unit, molecular entomology, neuroscience and aging research unit, epidemiology and biostatistics research unit, neurodegenerative unit, palliative care, and hosted by the Institute is the foremost ethics research committee, which is the UIUCH Ethics Research Committee. And the Institute is headed by the director, and the current director is Professor Ikeluwapo O. Ajayi, who is with us on the platform. Now let me hand over to the director so I can give our opening remarks. Thank you very much.
Thank you, Dr. Adeniji. Good afternoon, everyone. You are welcome to this edition of the IAMRAT seminar series titled Translational Research in Nigeria. The time to act is now. We are very happy that our dear Professor Babatunde Salako, the immediate past director of the Nigerian Institute for Medical Research, gladly accepted our invitation to present this month's lecture. We are very happy to have him, and his chosen topic is very apt and topical at this point in time in research globally. And we are all looking forward to what he has to share with us, his experience as the director of an institute, the PI of many research projects in Nigeria and internationally. So not to take much of our time, I want to welcome Professor Babatunde Salako and to thank him. And to all that have joined us, you are all welcome. Please mute your mic till we get to the question and answer time. I will then hand over to Dr. Solomon Bakari to present the citation for Professor Salako. You are all welcome. Thank you.
I thought you have done the citation already.
Oh, Dr. Bakari. Dr. Bakari.
Hello. Can you hear me? Hello. Hello.
We can hear you, please. Go on. Go on.
All right. Good afternoon, everyone. My name is Dr. A.S. Bakri, an associate professor of virology in IAMRAT. To read the citation of Professor B.L. Salako, who is our guest lecturer for this month. Professor Babatunde Lawal Salako is a seasoned physician, teacher, researcher, and administrator. He was the Director General of the Nigerian Institute of Medical Research, Yaba, Lagos, between 2016 and 2024. He is currently a professor of nephrology at the College of Medicine, University of Ibadan, and an honorary consultant physician and nephrologist at the University College Hospital, Ibadan, Nigeria. He became the head of the Department of Medicine in both institutions in 2011 and was the provost of the College of Medicine, University of Ibadan between 2014 and 2016. His foray into medicine began in 1986 when he obtained a bachelor's degree in medicine and surgery from the University of Ibadan and further went on to become a fellow of the West African College of Physicians in 1994. By dint of hard work and good clinical practice, he was elected fellow of the Royal College of Physicians of Edinburgh in 2014 and the Royal College of Physicians of London in 2016. Professor Salako was the chairman of the Nigerian Medical Association in Oyo State 2002 to 2004, editor of the Tropical Journal of Nephrology 2005 to 2012, assistant editor-in-chief, African Journal of Medicine and Medical Sciences, the official journal of the College of Medicine, University of Ibadan 2012 to 2014, and president of the Nigerian Association of Neurology 2016 to 2018. Over the years, Professor Salako has worked on hypertension and kidney diseases with grant support from the College of Medicine, University of Ibadan, Senate of the University of Ibadan, the MacArthur Foundation, and 5 NIH grants as both site PI and in a project with multiple PI on the H3 Africa Kidney Disease Research Network Consortium in collaboration with the Department of Public Health Sciences of the Loyola College, Chicago, University of Michigan, USA, University of Arizona, and University of Ghana. Professor Salako, with Neme International Pharmaceuticals, formulated the drug menopause and antihypertensive drug to replace minoxidil in the market when minoxidil became scarce in Nigeria. The Nigerian Institute of Medical Research, among other things, sequenced the index case of COVID-19 virus and developed both the DNA/RNA extraction kits for life science research and SARS-CoV-2 isothermal molecular assay for COVID-19 diagnosis under his leadership as the Director General of the Nigerian Institute of Medical Research. He is a temporary advisor to the WHO member Telephone Standing Committee on Research and Development, member of the General Assembly of the European and Developing Country Clinical Trial Partnership, ECTP, member of the WHO TDR Standing Committee and Joint Coordinating Board. He chaired the Disease Endemic Country Committee of the WHO TDR Joint Coordinating Board for 2 years. Professor Salako was appointed Foundation Fellow of the Nigerian Academy of Medicine, FNA Med, in 2019, and Fellow Nigerian Academy of Science FAS in February 2020. He was a member of the Lancet Nigeria Commission Central Bank of Nigeria body of experts on the healthcare sector research and development intervention grant scheme, chairman National Health Research Committee, and chairman National COVID-19 Consortium. He has received awards for commitment to medical practice and excellence by the board of the University College Hospital and the recognition as a worthy ambassador of the management of the University of Ibadan under a Lifetime Achievement Award. He has more than 230 published works in both local and international journals, including 2 books. With all this fascinating report, please join me in welcoming Professor Salako as he presents his work today. Professor Salako, over to you, sir.
Okay, thank you very much. Thank you very much, Director, for asking me to come and give this lecture. I must confess that I was a bit reluctant when she first approached me because there were many other things that were on my table at the time. But eventually, I decided to do this, and I hope that it will meet your expectations, as it were. I haven't seen the screen. I'm seeing myself. I think I should be seeing the screen now. Okay, let me pick. Uh-oh. Are we not? The person who is sharing the screen, I believe it should be me. Can you hear me? Aha, yes. Thank you very much. So make it in presentation mode. I need someone to respond to my talk so that I know that people are hearing
I'm with you,
me.
sir.
Yes. Okay. So I've decided to talk about translational research because of my experience as both Provost College of Medicine and my role as Director General of Nigerian Institute of Medical Research for 8 years. I did discover that we need to begin to point attention to this so that researchers and funders in Nigeria may refocus their attention on ensuring that in spite of our condition and where we are, we must engage in some level of translational research. And I believe that the time to act is now. Next slide. I'm going to go quickly through the Nigerian population and disease profile because the topic is about Nigeria, although I might be referring to Africa at some point, Nigeria being a typical African country. And research and translational research, examples of translational research, funding, I'm not sure if this was the, okay. Funding for research in Nigeria, research capacity, health workforce in Nigeria, strengthening research capacity in Nigeria, and then, of course, the challenges of translational research. Next one. So I'll start by talking about the Nigerian population, which is growing at about 2% per year. And our life expectancy, we all know, I choose to use the WHO figure, which is more encouraging, 61.2 for male and 64.1 for female. You compare that with a global average of about 73.3. We still have poor indices in the area of maternal morbidity, infant mortality, under 5 mortality. And of course, diverse ethnic groups and languages, which I believe these are some of the things that when we are conducting research, we must address them through translational research to see how our research can benefit these figures, especially that these are the figures that are being used to judge, so to speak, the performance of the health system of a country or of a nation. Then to the right side is the 2021 top 10 causes of death, lower respiratory tract infection, malaria, diarrhea diseases, tuberculosis, down to maternal conditions and HIV/AIDS. Now this changes from year to year, but basically most of these diseases continue to remain on the top 10 causes of death in Nigeria. Next one. Next slide. Next slide, please. So having in mind those poor health indices and the top 10 causes, research is what is next to be used to either reduce those indices or reduce the burden of those diseases on the right side. And I'm talking to the converted here. I will still say that research is systematic collection, collation, analysis, and interpretation of data to answer specific questions. That is very important so that we stop just doing research because we want to do research. Many of us are guilty of doing research because we want to do research and because we just want promotion. I believe the era that we are now really should do research that will answer specific questions, even in the situation that we are with our infrastructure and funding. And research has been shown to be an essential tool for improving human development, health, and health equity. And we need research to respond to some of the challenges that we have in the social health, agricultural challenges, technology challenges generally, not to talk of only health. Now, if we look at Nigeria as a country, the top 10 subject areas where we conduct research is medicine, engineering, social sciences, agricultural and biological sciences, up to number 10, which is art and planetary sciences, which I'm going to be talking about in the course of this lecture. Next one. So, translational research simply is research that is done at the basic level that results into discovery that can be taken to clinical trials that will then lead to improvement in health outcomes. Basic research, for the purpose of this lecture, I want to link all the three other researches here to translational research. The basic research basically does not have a particular direction. It's by curiosity of mind, trying to find a new knowledge, and eventually when one is found, an applied research could be used to use these findings to solve a particular problem. And when this is done in a small set of people or in the laboratory, it moves on to clinical research, which is designed to determine safety and effectiveness, efficacy of such either medication, devices, diagnostics, products, or treatment regime. So you see that basic applied and clinical research can be seen as three whole parts of translational research. Basic research being the beginning of the spectrum, applied research being in the middle, and of course, clinical research being the end of that spectrum. So we must do all of them at the same time. Translational research is a bidirectional process. Even though I have said from bench to bedside, you can also do from bedside to bench, meaning even if we have already gotten a product that we are using, and we can look at how that product is performing, and if we see that there is room for improvement, it can go from the bedside back to the bench. So the goal of translational research is the efficient movement of basic science discovery into clinical application. Unfortunately, not just in Nigeria alone, it's been shown to produce only small to moderate effects. And we're going to be talking about why this is so. Now, this slide only shows exactly what I've been talking about. It's like a schematic diagram. Basic sciences discovers whatever it is developed, and then of course produced, and then it's adopted by clinical research, clinical users. Next one. So what are the key considerations for designing effective and good translational research? We must have individual skills and ability. And I believe that we don't have a dearth of clinical research skills and ability, except that the little that we have are also living and are going away. So we have a big challenge, because even if you have infrastructure on the ground, you have funding on the ground, and there are no people to do the research, then there will be a problem. We need an appropriate infrastructure. The research, like I said before, has to be relevant to national policies. And not just national policies. If we have opportunity, it should also be relevant to global research policy needs. So we must not do any research that is not going to contribute to some of these things that I've mentioned. Now, in conducting the research, again, in the past, we sit in our offices, we propound our theories, we write our proposals without talking to the people the participants who are going to be the source for our data, or who are going to be in future the users of the results of our research. So we must involve the communities so that anytime we go back to them, either to use the results or for other things, they will be very receptive to it. This is something that has been growing in the past few years. So we now do a lot of community engagement when we do population studies within the community. This is very important. The research must also be actionable, meaning when your result is out, it has to move further than just publishing it. Something has to come out of it. Either a policy is coming out or a small discovery that is going to change the face of management of a particular disease condition, or change the process, the way certain diseases have been managed in the past. The process has to be credible. And of course, people should have access to the results, and it must benefit the community. Next one. So what are the challenges that we have faced? Now, there is a research practice gap. Even where we've conducted translational research, and we have produced, let us say, maybe a molecule that is very useful and has been tested, and of course it's been registered, we still need to get it to the practitioners who will use it. But what we've seen is that there is a research practice gap, or evidence practice gap, or what they call knowing and doing gap. People who already know that, oh, we now have a new molecule for hypertension, for example, but they are not using it. Why is this so? This is one of the reasons why people are not getting the kind of health care they should get. What is being recommended is not what they are getting, because some people along the line or in certain contexts are not willing to use the new knowledge. And this is usually due to, one, some individuals who may have their own theories about the new drug, or the new knowledge itself may have some challenges. For example, when COVID came and there was COVID vaccine, there were a lot of pushback from people. And of course, the context in which that new drug is going to be used. This is what has brought about the need for us to now continue to do implementation science research. Next one. Again, we found out that research findings are not being used by policymakers. These are the people who determine what is going to be done at the ministry level or at government level. And researchers are farther away from them. I believe what we need to do these days is to ensure that if we believe the research that we are going to do is along the research agendas of the country, then policymakers must be made to be part of this from the beginning. Then when we are already done with the research, we need to produce briefs that they understand, devoid of medical jargon, so to speak, that they can easily understand, a few pages that will interest them to want to see exactly what we have done and how this can benefit the ministry and the people of the country. Next one. So specifically for us in Nigeria, we have a problem of poor private sector participation in research. We couldn't get a lot of people during COVID to fund research, even though they were funding implementation of treatment for people, buying oxygen, buying this, buying that, but certainly only a few was able to give some money for research. We have the issue of public enemy number one for Nigeria, corruption, instability. And I believe more importantly is that the ministry developed research priorities and agenda, but researchers don't know about it. And this is one important thing that we need to understand. The policymakers who set the agenda, even though they are not doing it alone, they did it with some of the researchers in the research institutions. But yet, these things are not sent back to the research institutions, they are not disseminated. So people conduct research, and this research that they were conducting may not be useful to the country because they are not part of the research agenda. Next one. So we need to also build some skills where we have some gaps. Asking the right research question. That's not to say that we don't know how to do this, But in the past, because we don't have the funding, the people come from the global north with their own ideas and then dump the ideas with us. And because we don't have our own funding, we just do what they want to do. Again, we must try to conduct research that will lead to change in management of some condition, some policy brief for government, or in fact, some products that can change the face of management of some diseases, rather than research for just promotion that used to be common in the past. We need new skill sets. These days, African countries, including Nigeria, are beginning to engage in genomic research. We are getting big data. We need big servers. So we need new knowledge, new skill set, especially in IT, statistics, and bioinformatics. We need to improve on our ethics and our IB process. There are some institutions that are still not doing this very well. And I think more importantly are the issues of material transfer agreement. We need to be able to protect the data for our country and the samples so that we don't just be a conduit for moving samples and data to the people abroad while we cannot use them in Nigeria. So there is a need for us to be able to build biorepository, and I believe beyond that will be a biobank where some of the samples can be kept for secondary analysis in future, so that some of the questions that are not being asked right now may be asked in future, and there will be materials, data for those secondary analysis. We need to be able to manage large data, especially coming from genomics. And I believe more importantly, we must continue to ensure that we protect the future of research by training a lot of our young researchers in the area of grant writing, manuscript writing, and the capacity to win research funding, especially that we are not able to get funding from local sources. The research landscape around the country, like I mentioned before, high-income countries, they have the capacity. When we compete with them, they get more of the money, and we only get to work with them. So we need this capacity that I've described before to be able to compete appropriately with them. Especially that the ideas that they are pushing may not be our own primary ideas that will solve our own problem. So conclusions of such research often do not have any direct local benefit to us. Most of the research that we do in Nigeria, like all of you know, are donor-driven. And so he who dictates, who pays the piper dictates the tune. So far, health research has not gotten more than 0.08% of the health budget. We're supposed to be asking for 2%. And of course, we need to institutionalize research culture in many of our institutions. Next one. Now, let's take a look at the global research funding pattern. And some people have been talking about 10/90 gap, meaning that less than 10% of worldwide resources are spent every year on health problems of developing countries. While, and 90% of preventable deaths occurred in these areas. Yet, what we see is that developed countries get 90% of the funding, and they have less than 10% of the preventable deaths. And people are talking about reversing the gap. And I believe that if we don't have anything on the table, as Africans or as developing countries, we cannot be talking about changing or reversing 10/90 gap. Again, because he who pays the piper dictates the tune. So if we begin to fund research in our own individual countries, we can even have 100% by zero gap. Next one. Now, this is just to show how Nigeria is performing, even among smaller African countries, in terms of budgetary allocation to health. This has been perennial. We just hope that with advocacy and getting closer to decision makers and policy makers, we might be able to improve this. Nigeria is the lowest. spending the lowest among Niger, Ghana, Gambia, and Gabon, for example. Next one. Unfortunately, government spending has been associated with the amount of publication that can come from a country. And government spending has also been associated with the amount of citation. Because when you spend well, you'll probably be able to do good work that will be impressive for other scientists to cite. And we are not getting adequate funding for. So when they look at our research capacity and the number of publications we have in a year, and it's smaller, the only reason is that government has not been spending as much as it should be. Next one. However, we must mention what government has done. Government has done TED Fund, basically for tertiary institutions. Other research institutions cannot access TED Fund. Yet, government has put in TED Fund the National Research Fund. In many other countries, National Research Fund stands alone. Although the government does not want to create newer agency, but I believe National Research Fund should stand alone. Let TED Fund deals with other infrastructural issues with the university, so that research fund can be available to every researcher, whether in the university or in other research institutions. Next one. This is what has brought Justin Davis in 2016 to ask a very relevant question about research capacity in Africa. And it's wondering whether the sun will rise again, meaning that, next one, that we know that there is a little research capacity within Africa. There is a shortage of faculty and research leaders, inadequate facilities and infrastructure, and a few career opportunities for budding researchers. Fortunately, there is now widespread acknowledgement that African researchers are best placed to ask questions that are relevant to African issues. Before, they come with parachuted research ideas, and we just go ahead with it. Even they then now are agreeing with us that we are in the best place to ask our question. It's our story. But the question is, how can we do this without the local capacity? Next one. This tells the story of researcher per million population in Africa. And the figure to the left shows the figure of the world, the map of the world, showing researcher per million population. And the darker the color is, the more researcher per million population that you have. So if you look at Africa and look at Nigeria, you see that it's almost zero. If you come to Africa, which represent the figures on the right side, and the one on top, looking at the figure, South Africa and Nigeria appears to have the highest number of researchers. That is looking at it holistically. Now, if you look at the one below, and you now look at it per million population, you see that Nigerian value has gone down, and other African countries even look better than us. Of course, this is because of our population. So we don't have enough researchers per million population for Nigeria. And yet, these people are still living in droves. We need to do something to keep people in Nigeria to be able to have the adequate number of people that can conduct research in Nigeria. Next. Again, this is looking at the headforce challenges, the number of doctors and nurses that have been producing 2009 to 2018. We continue to increase the number. And that's the figures on the left. The one on the right is showing the migration trend. Now, this is up to 2018. You can imagine what it will be now. There would have been a steep rise at the end of 2018 to show that almost everybody is leaving. This is dangerous for our country. Some people have to take care of the population that continues to rise in Nigeria. So government should do something, and immediately too. And I believe that this is a knowledge that has already come to their attention, and hopefully we should be getting something done in the next few years. Next one. Next one. Now, this figures, the one on the left, is an interactive map, which is a world report by WHO on 9 funders showing funding, foreign fundings for African countries. But what interests me more is the one on the right side, which shows that we get more in Nigeria collaborative research than direct funding. So we are not getting more money, probably because our proposals are not competitive enough. I know there are other conditions that funders will look at, political instability and all of that may be part of it. But the real thing is that we need to train more of our researchers and get them to be able to write fundable proposals so that we can improve on direct funding to Nigeria and to our institution. That, of course, does not stop us from agitating the government to start funding research at home properly. Next one. Again, this is just to show that Nigeria is not doing quite well when it comes to these foreign fundings. South Africa, Uganda usually comes before us, before other countries. We're supposed to be the giants, the most populated, so we should have a comparative advantage over these other countries. Next one. Coming to Nigeria, just again taking a look at foreign fundings 2012 to 2016 and research institutions in Nigeria that have received funding. Of course, University of Ibadan, first and best, is the first. And then we have Institute of Human Virology, University of Lagos, Obafemi Awolowo, up till Jos University Teaching Hospital. These are the top 10 institutions that got funded by those 9 funders that I mentioned earlier on between 2012 and 2016. Next one. So what do we need to get the situation better? We need what I call sister research institution, maybe local or international. And this is being borrowed from a nephrology point of view, where we have Sister Renal Center. You have a Global North partner that is now mentoring a local renal center in terms of support, staff exchange, and training. And I believe this can be adapted to our universities. We can have mentor universities in the Global North, and we can have staff exchange, and our younger faculty can go there, train, learn about research, about funding, about grants, and of course, collaborate and network with them. Now, those of us at home, the senior people who are going to leave the system very soon, must necessarily replace themselves by mentoring people, pull them up, possibly for them to see much better than what you have seen, so that we can keep the flag flying back home when we leave the system. Now, I did mention before about implementation science, that we have seen situations around the world where discovery has been made, new modalities of therapy has been made, but we really haven't seen much change in some of these areas. And it is because there are certain challenges in moving those discovery to practice. So implementation science is a method that promotes integration of research findings and evidence into healthcare policy and practice. Next one. So the core components of implementation, of course, is successful integration of such treatment, and factors impacting on implementation success will include culture, the leadership, social, attitudinal, and professional opinion. Some of these things affect the use of new policy in treatment, new drug, and I give an example of a COVID-19 vaccine, where the vaccine is ready and people started saying all sorts of things, wrong information, especially on social media, that prevent a lot of people from accessing that vaccine. Next one. We must also try advocacy. Advocacy is something that, again, some people believe scientists should not be involved in. One, because there will be conflict of interest, that a scientist who is involved in developing a particular modalities of therapy shouldn't be the one carrying out advocacy. But with responsible advocacy, I believe a scientist can be involved, because talking to the decision makers is the scientist that can really tell the story the way it is. So advocacy is to ensure that people take ownership of our research ideas, the evidence that we have, and the proposal, so that in the long run, they can use them. So to win support from policy makers and decision makers, we necessarily as scientists must do a lot of advocacy. And our institutional leadership should also do this to ensure that most of the things that we need in terms of funding, infrastructure, and all of that, attention are paid to it. Otherwise, if we sit far away from them, they may not know what is happening to us. Recently, we launched a mobile laboratory and clinic for the detection of human papilloma virus in Ibadan. We brought in the governor, we brought in the deputy governor, we brought in the speaker, and we brought in people from the community who even serve on the board, advisory board for that team. And this is the way to go, so that on the long run, whatever we find on the field, it will be easy for these people to accept the recommendation coming from there. Next one. So decision makers are very important if we hope to transfer research-generated idea into policy. Next one. Now, one other thing that we must do in carrying our research is to ensure that we use the concept of One Health. In the past few decades, many of the endemic and pandemic that we have experienced have come from animal. For example, COVID came from bats, and then human interaction with that led to the outbreak of the disease. So for us to be able to do proper translational research that will lead into some groundbreaking findings for our health, we must stop doing only research in people without considering the implication of animal mixing with people and the environment that we live in. One Health really should be on the front burner when we are thinking of our research idea, especially in relation to the national priorities. The other bit that is a bit new is the planetary health, which is the health of the earth that we all live in. How do we use the earth? Our human activities really have led into depletion of ozone layer. We now have issues with global warming, climate change, extreme weather conditions, and these are all, it all came from the activities of human on earth. So we need to protect the earth itself, and we must continue to begin to do research in this area to ensure that we leave the earth better than we meet it, and for those who are coming behind, so that we don't sort of put the earth in an unlivable condition for those who are coming behind. Next one. We must also ensure to measure research impact. Oftentimes when we conduct research and we publish and we get promoted, we celebrate all of that, we don't go further to see what impact has those publications made on the life of the people, the health of the people, the health system itself. So research impact is a demonstrable contribution that an excellent research makes to society, the economy, and the development of the nation. If we continue to do this, we will be able to show those who are funding, or those who we are asking funding from, or those who we are asking to improve our infrastructure, evidence for them to do so. We must henceforth ensure that we try to measure research impact in whatever research that we carry out. Next one. I say the time to act is now, in spite of the poor stories that I've told about our infrastructure, about our researchers living poor remuneration, poor research conditions, but we must continue to grow. Nigeria requires an R&D system, a fit for purpose. We need to design what is fit for us in our situation. It's very crucial for Nigeria to drive innovation. We must therefore pay attention to a robust national research priority and agenda. We used to have an old research priority, which was outdated by 2014. We are in the process of writing another one, and we are yet to get that published. That is a challenge that we have within the ministry and change of hands. We need to have fit-for-purpose R&D workforce. We need to train people, strong resource base, and we must maintain our networking and collaboration, because that I'm sure we have. But what we don't have is a relationship with the industries, innovators and industries. In the past, there used to be a very good relationship between the pharmaceutical companies and researchers in the universities. Maybe the economy now, I don't know, we've lost that relationship. We need to go back there. And we must not forget our global partnership. We already have strong regulatory system to look at the way people conduct research and ensure that some of those things that should be done are done. We have IRB in some very strong universities, and they continue to ensure that research provide approval to researchers who wants to conduct research. I think we should also pay attention to knowledge transfer. If we are not able to develop our own, if we see one that can be useful to us, government needs to imbibe that. About 2 years ago, Nigeria was named one of, I think, 6 countries, African countries, to produce COVID-19 vaccine. We are yet to do that up till now, even though we don't need COVID now any longer. But we should be able to produce other vaccines. After all, we've been producing vaccines in the past. Next one. Now, we must also ensure that we conduct both upstream and downstream research. The argument that because we don't have adequate infrastructure, we don't have this, we don't have that, we cannot be involved in experimental research that can lead to scientific discovery or breakthrough technologies should not hold waters for me. Because if we don't create our own innovations, we cannot answer our research questions. What we are doing mainly now with R&D is downstream research, just helping people to test safety and efficacy of products that they have developed in their own country and are brought to our own country. Nigeria needs to be involved in both downstream and upstream research in order to be able to design its own research and ask relevant questions that directly provide solutions to its health challenges and also for global impact. Next one. Next one. So what do we need to be able to do our own fit for purpose? We must understand the challenges. We already know, we've been talking about it. The technology needs, we need the national research priority, adequate workforce, train them to improve their research capacity, and more importantly, co-creation of innovation platform with private sector. We have to go back to town. The academia should go back to town, because if the town does not come to gown, gown should go to town. Let's both create co-creation hubs where they can put some little funding, as much as it's available, for a little, again, breakthroughs that we can do with whatever that is available. I don't believe we should just sit down and say, oh, we don't have this, so we cannot do this. We must go beyond that and see that if we collaborate with private sector, they may save us what government is not doing. Next one. So we need to ensure that our mission are well aligned, so that the country's research priorities and agenda is what is driving the kind of research and development that we're doing. We have to show clarity of what we want. It must necessarily shape national development. And we must ensure that in all of this, creativity and innovation that will lead to economic prosperity of our nation is involved in it. More importantly, we must also learn about risk tolerance, because if we are going to do portfolios that will end up in production of some drugs elsewhere, we must look at market dynamics so that we don't get the wrong ideas. Because if we do that, we will not make funding or be able to develop what we want to develop in that area. Next one. More importantly, we need talent development. And I believe that this should be at research institution level. We should be able to identify younger people who are talented, who can work, who we can fund directly in the area of relevant interest for us. For us to get a fit for purpose R&D work that can respond to innovation. We must also ensure that we keep our global and local partners, because working together can drive innovation much better than working alone. And for us as a country, if we are not able to produce our own technology, we can do technology scouting. Look at relevant technology that can assist us. For example, the time when we were asked to go and produce COVID-19 vaccines, we were talking about technology transfer. And all we needed was government support and some kind of coordination for us to have started this. This is something that we have done before. It shouldn't be a problem at all. So technology scouting is something that the country can do as a stopgap until we're able to develop our own. Next one. So the last slide here is the realization by African leaders that Africa is not growing. We're just like markets for the global north. And so they realized they needed to come up with an agenda. And each time I show this slide, some people are wondering, 2063 is too far. They named it Agenda 2063, the Africa we want. And I believe they realized the fact that they must plan so that by 2063, Africa would have changed. They have 7 aspirations, and one of the background there says by 2063, African countries will be amongst the best performers in global quality of life measures. This will be attended through strategies of inclusive growth, job creation, increasing agricultural production, investment in science and technology, research and innovation, gender equality, youth empowerment, and the provision of basic services, including health, nutrition, education, shelter, water, and sanitation. This indeed is a very holistic way of looking at the African problem. And I believe if African leaders can walk the talk, in this case, Nigeria can walk the talk, by 2063, we should tell a different story. Now, example of translational research, which has been done in our present condition. When COVID came to Nigeria, the Nigerian Institute of Medical Research, where I was DG then, sequenced the sample from the index case. And at that time, we cannot say we have everything we needed. But because we were driven by the interest to contribute something important to that condition, within what we have, with the little experience that those chaps have, people that I can call talented people, we did a partial sequence of that virus. 3 days we were in the lab, burning diesels and energy. Thank God, Naira was not what it is now. Maybe we would not have been able to do that. And 3 days after, we came up with a partial sequence that was 98%, 98 point something percent, close to the original Wuhan virus. I think 5 days or so after we started, Redeemer University also came up with a full sequence, and both reports were put together at the time. Next one. Now, the translation part of it was that virus was grown and sequenced and from the genetic architecture of the virus. Again, these talented individuals in NIMA produced 2 test kits. And the first one was an isothermal point of care field testing that can be taken to the field. Unfortunately, this was adapted to an isothermal machine that was not being produced in Nigeria. In any case, we don't produce any of those things in Nigeria. By the time it broke out that we have used that machine to be able to detect the virus within 1 hour, and I wanted to roll it out, they refused to sell the machine to us. So that discovery became very useless. We had to go back again because of the knowledge that these chaps have with the first one to develop another one, which is a molecular assay that can use a real-time PCR at the time. Now that had about 98% sensitivity and 100% specificity. This one was sold for about 30 million in the midst of COVID-19 testing in Nigeria at the time. We just wanted to prove that we could actually come from innovation to the market. Unfortunately for the buyer, no sooner than he bought it, COVID started to wane down. And I'm not sure if he recovers his money. These are part of the challenges that we have when we create innovation in Nigeria. We need government support, we need government policy to support whatever is being created locally so that we can develop them. We need our own Silicon Valley, research institutions surrounded by companies that are willing to put funding into innovations so that these things can be produced in Nigeria and they can be cheap and can be easily available for our people. Next one. So we also produce both RNA extraction kits at the point that RNA extraction kit became scarce. The NCDC at the time spoke to us, and we came up with RNA extraction kit because we had already done a DNA extraction kit before. Those who work in the lab on a daily basis understand the need for this kit, and they have become standard for testing NIMA since then. Next one, in conclusion. Translational research goal is to move research discovery from basic science to bedside, and it is bi-directional process. However, the impact has remained rather small in Nigeria as there remains a gap between the health practice that Nigerian patients receive and the available evidence and treatment. There is need to promote implementation science and design a fit-for-purpose R&D system to close this gap. Adequate funding, research capacity development, multidisciplinary research approach, and mentorship program will improve translational research efforts in Nigeria. Decision and policymakers' involvement in design of research and advocacy will improve research translation to policy. The time to act is now. I thank you very much for listening. Over.
Thank you very much, Prof, for that very illuminating lecture, well delivered, very lucid, and really you have educated us, especially with things happening in Nigeria and how the challenges we're facing can be addressed. And even the source of some of these challenges were elucidated by you. We are very grateful, and I'm sure that many of us here are very, very happy to have joined this lecture. So I think I will hand over to Dr. Adeniji. Are you there? Dr. Adeniji. Okay, Professor Rufus Akinyemi, please, can you take up the question and answer session, please? Thank you.
Okay, thank you, ma'am. Professor Akinyemi is going to handle the question and answer segment of this seminar series. So, Professor Akinyemi, please, you have the floor.
All right. Thank you very much, Director, for asking me to handle the Q&A. I want to sincerely appreciate my teacher and mentor, Professor Salako, for this very illuminating and very inspiring lecture this afternoon. Certainly, translational research is the way to go. It's a solution to our challenges as a nation and as a continent. And you're giving us the notes both of translational research and highlighted the gaps. Also brought to us the possibilities as relevant to our nation and what needs to be done. And of course, you spoke from an experiential point of view, provided us with a model of what you achieved when you were there with affairs in IAMRAT. Especially, we are witnesses to what you did during COVID-19 pandemic. So thank you very much, sir.
Thank you.
The floor is open for comments and questions. I saw Professor Mazimbello's hand up. So if you want to ask a question or make some comment, can you indicate by raising up your electronic hand, or you may please type your comments in the chat box. So I will then, so we want to have some conversation with our esteemed teacher before we wrap up today's webinar. All right, so Professor Mazimbello, you may please make your comment, please. Hello, Professor Mazimbello. Thought I saw your hand. All right.
In the chat box, it said it's an applause.
Oh, right. Okay. All right. Okay. All right. That's fine. Okay. All right. Let me just to set the, okay, there's a question in the box from Dr. Andrew Kamayaji. I appreciate our speaker for very lovely presentation. I mentioned that we do have, okay, all right. So would, in the order of people have raised their hands, let's start now. I can see 3 hands. Professor Falusi, President of IAMRAT, Dr. Mohammed Afolabi, and Dr. Professor John Aneto. So may we have you in quick succession, and then Professor Adimowo, let's have your brief comments, and then to which our speaker will respond. Maybe let's take the comments in batches of 4. So let's have the first 4 comments, and then our speaker will respond to them. Let's start with Professor Falusi.
Thank you for not marrying me away to somebody else. After 56 years of marriage, I don't want to marry somebody else. Thank you very much.
It's okay. I saw Professor Professor Wale Adebiyi face to face today. We're in a meeting together. So in UI. So and I told him that.
Okay.
Ademo, are you Professor Falus is speaking? What are you saying? This is not for this place. Mute you.
Thank you very much. I am delighted to have listened and showing us the map of Nigeria and where we are in the scope of research and question by saying that we are still behind, or you made a statement that we are behind. That's acceptable. But then you have not answered the question how we can move forward. Because what I can say as a researcher of many years is that almost every grant that we get for anybody who's gotten grants before, these grants are from outside this country. Almost everything is from outside this country. And then some of the grants like NIH and all those people will say, unless you tie to somebody in an API. What are we really doing to be able to support research in our own country? Because the younger people coming behind us, in those days we used to fly around, go to Europe, go to this 3 times a year, get something, you know, and so on. But now they can't even fly as much anymore. A few people can still fly, but many cannot fly. So how are we going to help the younger ones coming behind us if these grants are not available in our own country? We are aware of how much money is circulating in this country. We hear of humongous amount of money being spent on, I don't know, so many things. But instead of having this tailored towards grants for colleagues, for younger people to excel and make an impact in the country, we're not able to get that. You have to go abroad to go and look for your grants. And after a while, people will stop giving us. They do give us, but why can't we have a large pool of money in this country devoted to grants and funding and everything? We talk about this every day. How much is allocated to research? What is the proportion to research that young people can tap on? They can even start there. It's almost not available. So I think the question still keeps going around until we can answer that question and make some people who have the money give it to people to do the research. We still continue to be behind. Thank you very much.
All right. Thank you very much, Ma. Also, Mrs. Falusi. Yeah, thank you, Ma. So very quickly, we'll take Dr. Mohammed Afolabi and then Professor John and Anita, Professor Ademo in that order. So what they would, our speaker would then respond to those first for comments. Dr. Falabi, please, you have the floor.
Yes, thank you very much, Professor Akinyemi, and let me start by thanking our Professor Babatunde Salako for that brilliant lecture. As he emphasized, translational research is indeed the bedrock of population health in any developing nation, more importantly in Nigeria. I don't want to go through everything that he has mentioned. I just want to ask one question and one comment. The first question relates to what Professor Falusi mentioned. I want to ask, in the context of the inadequate research funding in Nigeria, I don't know what NIMA Foundation, which I believe Professor Salako is well aware and is also an active member, what is NIMA Foundation doing in the aspect of public-private funding of research in Nigeria? Then secondly, on a positive note, I read online this morning that the Federal Ministry of Education in Nigeria is launching a bridge program. And that's an initiative to connect Nigeria diaspora professionals with a domestic institution to foster research, innovation, and capacity development. It looks like a promising step, and I hope it works. I'm happy to put the link here. I hope it will address one of the points that Professor Salako mentioned in terms of creating a kind of a system whereby there will be connection between Nigeria institution and institution in the global north. Thank you very much once again, sir.
All right, so now we take Professor John Aneto.
Good afternoon, everyone. Hello.
Yes,
Hello,
we can hear you, sir. Please go ahead.
Yes. Well, thank you. Thank you very much, Professor Salako, for a very good lecture. You said that we have to have purpose-built or fit for purpose translational research. And have enough of basic research that is purpose-built to base indigenous translational research on. This is based on the premise of what Professor Falusi said, that most of the research that were conducted in the past were mostly donor-driven, and most of these donors were from outside. And like we often say, he who pays the piper dictates the tune. Are we sure that if we want to go the pathway of translational research, that we have adequate basic research, which should be the foundation of translational research? Thank you very much.
All right, thank you very much, Professor Aneto. Now, may we have Professor Adimowo? You can make your comments, sir. Yes, please unmute. You're muted. Or can the IT unit unmute Professor Adimowo so they can make his comments? All right.
Okay, thank you. Yeah. I want to. Hello, can you see me? Oh, okay.
Yes, we can hear you. We can see and hear you, sir.
Yeah, I want to, first of all, thank and appreciate Professor Salako for that highly impactful and illuminating lecture that really spoke the truth. It shows somebody who really understands the research system in the country. But of course, that's coming from a former DG of NIMA. So we don't expect less from him. Yeah, Professor Salako seems to have said everything. We don't have to start recapitulating again. But straight to my own point, this Agenda 2063 is a beautiful one. I listened attentively when he was reading it out. However, it looks to me like it's going to be a mirage, except we change our attitude. Everybody has a fault here, both the researchers, our institutions, the government. It's like when you have problem with the followership, the leadership also, even if you have good leaders, you still have problem with the followers. So that's all of us have our concern, our problems. Some of us, I mean, the research scientists, they will not work together. Collaboration is a major problem. People want to do things in their own way. You want to work with only some people who are from your kind of sentiment, putting you together. Somebody is my member of my church. He's my member of my family. He's from my town. You know, those kind of things. There are some of the things that are causing problem for us. And also, the fact that many people don't want to fund research in Nigeria, indigenous research. As everybody has said, we need to be able to sell our research ideas to funders, local people who can fund our research. Take, for example, I wanted to do PSA some few years ago, and I asked my consultant, I said, oh, now he should tell me more about the values of this PSA. And you know what he told me? He said the PSA values we are relying on is actually, for the standard values, are those that are from those that are actually done by those in the West, which means that it is not even the values are not those of we Africans. And I said, why would we not have that? He said, nobody has done the research. And people do PSA all the time. So you see, those are simple things that people can even institutions can support. And then we have our own true values that can be our own reference point. And so we have so many kinds of things like that. And then about this issue that Dr. Afolabi re-emphasized, the issue of bringing those from diaspora, linking them with scientists at home so that they can work together. I must say that this is not the first time this kind of thing is coming up. There is this problem of lack of continuity. There was a time when NUC called us some few years back. I was there in NUC. They brought somebody from the US in Nigerian. And then they said, oh, bringing people from diaspora and African together. And they brought us from like 8 universities. So we worked with this man. I was made chairman of one of the committees, presided the needs assessment committee for the universities. But what happened? Immediately, Okoje left. That initiative died. Unfortunately, I met with his successor within the University of Ibadan. He came for a program. And also, fortunately, one of the staff administrator who served on that committee in NUC was also there. So I spoke with the two of them. I said, now, what happened to this thing? But I can tell you that was the end of it. So I hope this one also will not go the same way. So these are some of the challenges that we have. So there is this issue of lack of continuity. We have to do something about. We have to also change our own attitude. And of course, most importantly, is that government must be ready, they must be willing, because even when we do all the research, they are not, and those in the ministry, they are the policy makers. Oftentimes, they are not even ready to use those findings. They prefer using findings that are dictated to them by WHO from Geneva or elsewhere. So these are some of the challenges that we have. So thank you very much, Professor Salako.
All right. So we'll now have Professor Salako respond to this first set of questions and comments. Yes,
thank you very much, Professor Adimo and Rufus. Let me start from Professor Adimo's observation. Agenda 2063. Yes, it looks like a white elephant project, but this was an initiative that was done by the African leaders themselves. And now they have a peer review who looks at their progress and how aligned they are to the agenda. So I imagine that they should be doing it in a way. I cannot comment much on whether they will be able to do it or they will not be able to do it. But to talk about us as researchers working in silos and all of that, I think that has become things of the past. Anybody who is working in silos and is working based on ethnic, religious, or whatever background is only wasting his time, because the skills that you are looking for are unlikely to be ethnic based, they are unlikely to be religious based. So you should just look for people who have the capacity and the skills that you want to be able to move on. So that would be my comment on that. I think the one that interests me most is Professor Aneto. Can we do translational research? I gave you an example, and I gave you only two because I didn't want to bother you on what we did in NIMA. But I just show you two. It was basic research to clinical research. So it depends on who is doing it, who is driving it, and what you want. If we say that, okay, we don't have internet, we don't have electricity, we are not going to do anything. No. That is what is called innovation. In our own difficulty and challenges, we should find a way. That is what I meant. You should find a way. And that's why I said the time to act is now, that we have waited for too long. We have been asking stories, hey, government is not giving us this, we are not getting this, this one is not, we're just, it will never be enough. Even in Global North, the funds are not enough. They are not enough. So whatever we can do within the capacity that we have and the funding that is available is what I'm preaching that we should start to do, so that we don't end up being dumping ground for every research opportunities that come from the Global North, where we only serve their own interests. There are situations where all we do is collect sample, collect data, and ship it. Those things should stop, so that we can be doing things that we know will be useful to us. And when I mean that it should stop, I'm not saying that we cannot do research where they will still take samples. But many of the skills that they are going to do with those samples and data there should be done here. It should be like holding our hands to train us, to give us the skill. So we don't just be like a conduit pipe. So for me, Professor Aneto, I believe that we can, and we are. It depends on who is driving it. Now, the issue of NIMA Foundation. We created NIMA Foundation because we saw that government was not going to give us all that we want. So we said, let us create a foundation and see whether we can link up with the private sector. And we did create it, and the foundation, through the chairman, His Excellency Babatunde Raji Fashola, raised about 500 million. That fund, although we are not using it for research, we are using it for training, to conduct grant writing training twice a year for junior or young researchers in Nigeria. That is the best it could do for now. But what was actually planned was that it will give fund out as research to support students with PhDs and masters. Those are the things that we wanted to do. But 500 million certainly cannot do that. So we decided that, okay, let's be training the people. I mean, maybe if they have enough skills, they can bring in more money. I like the fact that people in the diaspora should be coming home. I don't think it's new. We are almost all of us are working with one diaspora person or the other. Afolabi, who just spoke, somebody is working with him. I think there was a point that I was working with him. So it's not new. It's just that maybe government wants to coordinate it, because we also have our issues. People who come from diaspora, sometimes, some people, I'm sorry to say this, comes with the air of superiority on those of us who are at home. And those of us who are at home, some of us feel insecure. These are the issues why we cannot work together. But if those who are coming know that the people who are at home are sacrificing and they are working under extreme conditions, then they will know that they are unable to practice what we are practicing as a researcher in Nigeria compared to where they're coming from. But I think if the government hopes to coordinate this, that will be fine. Now, to Professor Falusima, I did answer the question. Funding is not the only problem for research, for translational research not growing. even though funding is the elephant in the room. We talked about workforce. We talked about infrastructure. And we talk about research environment that is required for translational research to take place. Some of these we cannot say they are at zero. Maybe funding can be said to be at zero. All these other ones are not at zero. So we just need to try and work for funding. And I did say that you need advocacy. We've been sitting in our offices, we don't go to talk to the politicians. We only abuse them. We tell them they shop money, they do this, but we didn't go to them to go and collect part of the one we think they are shopping. We have to talk to them. And I'll give you an example. When we started going out for NIMA Foundation, we went to the assembly. We went to meet the Senate president. We went to meet the Speaker of the House. We went to meet the Minister of Budget and Planning. That lobby increased NIMA's research funding by 1 billion naira. So I know 1 billion naira again is small for research, completely small. But you see, if we all have started going and they begin to realize that this thing is really important, and we are able to show them the impact, the research that we have made in terms of reduction in those mortalities, disease burden, and all of that. And of course, we've also forgotten that most of us scientists looked at research as just education. There is a business in research. We need to come out with that idea that research can bring funding, that people can bring money, support research, innovation can come up, and it can become money. It can lead to startup company. People can get employment. By the time they are hearing this, people talk about political economy, that what the politician wants to hear is something that will lead to votes. He just doesn't want to hear that he reduces debt from 100 to 10. So what? But if he hears that, oh, he can create job, people can start a company, they can make money, then they start to think, yeah, okay, this is so we also need to do a job on advocacy. We have to go out, have to look for experts and do it the best way we should. The National Health Research Committee, headed by somebody whom Professor Falusi knows, has also put together a bill to create a health research funding agency. Before I left NIMA, we got it through the assembly. Unfortunately, the president couldn't sign it before he left. When the new president came, certainly it wasn't a health research agency that was in front of him. There were so many others that he needed to look at. So it lapsed. Now he's going back. The bill is back to the ministry. The ministry is going to take it as an executive bill. So hopefully, because that is the only final solution that we can have from government. When we get a health research agency enacted, then there will be some funding. It may not be enough, but certainly health researchers can find places to go for funding. So I think that we just need to do a little bit more than we are doing now.
All right. Thank you very much, esteemed speaker. You've addressed the questions that you raised by our gross audience, highlighting the very critical areas. I like the last point you made, sir, about the health research agency for the country. And obviously, events in the funding landscape, from the global north, from the US in particular, in the last 6 months, I think it is a signal that every country needs to try to postgraduate students, educated researchers, and different strata of research. People can be aware of what are the research priorities for the country, and ensure that that whatever research they do are in alignment with the research priorities for the country. I think it's important we have that document in the public domain. You also highlighted the example of the HPV consortium. I think one of the challenges that we are not having support from government or private agencies because we miss the strategy. We only go to them when we think we have some research products. It doesn't work. The principle of co-creation, you start talking to them right from the conception of the research, so that there's that sense of this is our thing, sense of belonging, sense of co-ownership. So co-creation, co-development of research ideas with the community, funders, and all partners being at the table. I think that's something you also mentioned with the HPV consortium as demonstrated adequately with the recent launch. I think it's also a way for us to go as institutions and researchers, countries. And I think it's also high time we have an IAMRAT foundation to support our institutes. I'm sure my director and the team will look closely into this as an institute to also want to support researching on our institute. Well, I want to apologize. I'm not sure we're able to take every speaker today. Except you can assure me that you only make a comment for just 1 minute. But before I call Dr. Williams, I can tell you, and I'll use for 1 minute comment. There are some important points in the chat box. I just want to highlight two of them. Two people wrote about mentorship. Structured mentorship program. I just want to draw your attention that the last IAMRAT Day event that we had on the 8th of June was focused on mentorship. It says that early career researchers wrote on mentorship. So I will refer you to the recording of that event. It has every information you will need about mentorship. Right. And then Dr. Yayi talked about philanthropy, capacity building. I think our speaker has addressed eloquently. So very quickly before we go, Dr. William, I can say 1 minute, and then I'll leave you to Suleiman, and then I will call it a day. All right. So Akintaye, you have the floor, please. Dr. Akintaye, very quickly.
Thank you, sir, for the opportunity. I want to thank Dr. Falako, and but I still have an issue with the question Professor Falusi raised, the issue of infrastructure, and then not only infrastructure, the workforce. Most of researchers and people are interested in doing research are moving up north because of infrastructure, security of life, and even finance and other issues. What is I know we are not the government, what efforts is being made to mitigate it? Because the statistics that was shown is even more alarming even now. Even those that are remaining are looking for a way to find their way up north and all that. How can this be mitigated? Thank you very much.
Okay, let's read it to Dr. Ali Suleiman very briefly, and then Professor Salako will address the two comments before we. Okay. Yes, Dr. Suleiman, you have the floor, please.
Good evening, sir. Good evening, everyone. My question is that Prof talked about the fit for purpose research approach. Please, Prof, could you kindly give example of what that looks like in the Nigerian context? Thank you.
Sorry, come again.
You talked about a fit for purpose research approach.
Okay.
Could you kindly give an example of what that looks like in a Nigerian context?
Okay. All right.
Yes, so you can respond to the comment from the two esteemed gentlemen.
Well, I think the person who asked about mitigating JAPA also knows the solution to it. Because the question will be, what will make you not to japa? Anything that will make you not to japa will be the solution to your question. I think basically government needed to do better to improve the research working environment. For example, we are talking about electricity. Institutions cannot pay electricity. We can't even stay in our offices because it's not conducive to do so. Not to talk of being able to, especially those who do basic research. Where would they, how would they, is it when you are incubating something and they take light that will encourage what you are doing? Then we start talking about alternative energy and all of that. These are very basic issues that are very important in ensuring that we do good research. Okay? Government needed to improve that research environment. The other bit is the training of the workforce. People who are leaving have a lot of experience that they are going with. We have only young people who are left behind, and they need to be trained for us to maintain the level of research capacity that we used to have before. But you see, my own challenge is that everything that we want, government cannot give at present. Let me put it that way. So those of us who find ourselves as heads of research institutions and university needs to come up with our own innovation. You may not be able to do everything. You can pick a particular area and choose to support it with the little funding that you have to do what you think it can do. There is no way, no area where everybody gets exactly what he wants. Even in America, they don't have enough funding for research. Yet they are giving us, but they still complain they want more. So if we are waiting for an ideal situation, we may not be able to do anything. This is the point that I'm trying to make. That those people who lead research institutions should find innovative ways of ensuring that they do something. But the major thing is that we must not just sit in our comfort zone. We should get out of our comfort zone and go and talk to government. A lot of the time, so many things on government tray, and if you don't go there to discuss and lobby for your own, others who go there will get the money. And there's nothing we can do. So we must stop talking about we don't have this, we don't do this, we don't do this. We don't, we know. We've been singing that song for donkey years and it's not changing. So we should take the battle to the doorstep of government. That's why I talked about advocacy and being able to talk to them in the language that they will understand so that we can get some little funding out for research. We are talking about, okay, government is going to enact a bill for health research funding agency. Our chairman is planning how we can visit assembly, visit Minister of Budget and Planning, visit, even if possible, visit the president, for them to know that health is very important to the economy of a nation and national development. Now, the kind of fit for purpose that we are talking about, I gave an example that about 2 years ago, the WHO named about 6 countries, Nigeria was one of them, for technology transfer to develop, to start producing COVID-19 vaccine. Of course, you cannot have a technology company like that without having a research outfit with it. So you have to determine whether what you want to do is develop a company that will be able to produce all the vaccines that you want, or you want to be able to do the ones that will do only one or two that are important to you. Because fit for purpose means something that can deliver to you what you need at the time, not everything that you need. If we had, there was a company being created by government, between government and this drug company. They call it Biovaccine Nigerian Limited. And Biovaccine Nigerian Limited was thinking of building a plant that will be able to produce all the vaccines that Nigeria was producing before. And it wasn't moving. Even after government gave an initial startup fund of about 10 billion as part of the funding to do that. But then we needed to create, to produce COVID vaccines. And there were issues about, okay, which one should we go for? Should we go for modular laboratories that would have been produced basically to produce only one or two particular vaccines? Or should we be waiting to finish developing the ones that Biovaccine Nigeria Limited was trying to do? These are questions that leads to fit for purpose kind of research and development that you need to do in a nation. Thank you.
Thank you very much, Sir Professor Salako, for your brilliant responses to the questions from our esteemed audience. One agree that it's been a very wonderful almost 2 hours of deep engagement with our speaker, and of course also with our esteemed experienced researchers and the different levels of expertise. It's been a very great interactive session these afternoons. And of course, time is never a friend. Whatever has a beginning must have an end. But I hope I've taken away one or two points from this afternoon's lecture. One quick point: the time is ripe for us to emphasize translational research in Nigeria that is responsive to our priorities, health priorities as a nation. And every research we do as individuals, as groups, institutions, departments, must ensure that they are responsive to the health needs and priorities of our country. Then there are several gaps: funding gaps, capacity gap, infrastructural gap. They're all there, and there are initiatives, efforts to bridge some of these gaps. I want us to see our cup as half full, not half empty, no matter how bad things are. We need to partner locally with the global south, even with the global north. We need to also know that in spite of all the challenges, there are pockets of researchers or research groups that are doing great work. We've seen examples of translational research in Naima. And what Prof spoke about was just the tip of the iceberg of what he accomplished as NAMADG in 8 years. He has shown that it is possible to transform institutes and to change narratives. And we can take a cue from that even to transform our own digital corners as well. The need for funding cannot be emphasized, but the need to engage with all stakeholders. They need to co-create research programs, work with communities, funders, the private sector, policymakers, carry them along right from the onset of the program. That will secure better buy-in from them. And of course, they need to innovate, even in the only two corner. They need to also build capacity. Many thanks to what NAMA is doing, what IAMRAT and Nigerian also do to build capacity, develop mentoring programs, and create pilot grants that ECRs can use generate follow data that can be used to attract global funding. I'll coordinate for capacity building, grantmanship, so that we can attract more grants, both from Nigeria and of course from other global funders, so that we have better research income for our country, but more importantly, to change the narratives and improve the health indices of our dear nation, Nigeria. So I just like to hand over back to my director so that she can make her closing remarks and then close us off for the day. Over back to you, Professor Ajayi.
Thank you very much, Professor Akinyemi. That was a good session. Well, anchored. May I tell our participants to please register for this lecture series using the Google form that I've just shared the link. Please do that, and then we can send you whatever you need. I want to again thank Professor Salako, but before I acknowledge everyone, I want to just mention 2 or 3 important things that I think our participants would appreciate. During the talk, Professor Salako mentioned the issue of data sharing, and I just want to advise our participants, our researchers, that they should please get informed consent from subjects when they are getting informed consent to carry out their research. And they should mention there, if they have the intention of using the data at a later date, it should be clearly stated in the informed consent form. And the subjects should also be made to understand this. There's a lot going on globally now about the ethics of using secondary data. And I don't want us to be caught in this. If you do not take consent at the time you are collecting your data, that you are going to reuse or use that information for any other relevant study or analysis, you may find it very difficult to publish your work. And again, it's not ethical. So please, I want you to go home with that information. Yeah, the other thing is the issue of the bridge program. Thank you, Prof, for telling us about this. But I want to enjoin you to please, if you're a member of that program, that research institutes should be included, because you are talking about Ministry of Education. At times, like IAMRAT, we are under College of Medicine, and that means Ministry of Health. But then education is also going on in these research institutes, which we need to inform when there are programs that cut across the 2 areas. So please, it will be good that we get the research institutes included. And that brings me to the issue of training and mentoring. This is a very challenging issue, and it's topical now, as we have many young researchers or to-be researchers who are yearning for mentoring. Professor Akinyemi has mentioned about our last IAMRAT Day, and also the last month, the June, is it June or May lecture series, where Professor Tomori also talked about mentoring. And a lot of young researchers are looking forward to the research institutes, taking them up and helping them. So please, Prof, we will talk more. We are trying to plan a program, and Professor Rufus has mentioned this. We need to really step up with our mentoring activities at the research institutes. So the other thing will be that I want to thank the all our participants. I know some of us are leaving. It's been a long day, but we want to apologize. We start a little bit late because of some technical issues. But it was worth our wait, and we know that this is a day to remember. I want to thank our former directors, that is directors of IAMRAT, Professor Falusi, Professor Falade, who joined us, the living legends amongst us, Professor Shoyonwu, Professor Neto, and I think others who were with us at this lecture. I also want to thank our international partners who joined. I could identify American Society for Microbiology, and there were some names that I know are not Nigerian names. So I want to thank all our international collaborators and friends that joined on this lecture. Professor Afolabi Mohammed has been mentioned. He's been a supporter. He's also delivered the lecture for IAMRAT. He's based in the UK, and he's always been with us. Thank you very much for your support. I want to thank the Vice Chancellor of Chrisland University, despite his busy schedule. That's Professor Oladunni Arulogun. She was also with us on this program, and she's an astute researcher herself and affiliated in one way or the other to IAMRAT. So these are people we need to really run after to support us more. And I want to thank the ICOMA, who was represented by Professor Asinobi. And I think if Professor Asinobi is still here, you've had all the challenges, and I know that our ICOMA people are really doing great. Please remember the research institutes that belongs to the college, that they should also please extend funds and support even resource, material, human, to support the institute. We've mentioned this to the provost at some point, so we're looking forward to your support. So I want to say a big thank you once again. Professor Salako, we can't thank you enough. You are back now to the college, and you've been part of IAMRAT. You were part of the board members at some point. So we would like you to please adopt us and come and help us and replicate the good work you did in NIMA. Now you are back at home. Let's your home institute also really get pushed forward. I'll say catapulted, because I know what you can do. So I thank everyone, and I pray that next month's lecture would also be successful. And I want to enjoin everyone to be on the alert the last Wednesday of the month at 3 p.m. Don't even wait for the flyer. Just know it's going to happen. And we're having another very important diaspora expert who is coming to deliver the lecture next month. So what do they say? They say, be on the lookout. It's going to be interesting. I wish you all a wonderful evening and success in your research work. IAMRAT is there. Please come for collaboration and also to set up your research outfits. We are very happy to welcome you. Thank you. And to my team in IAMRAT, thank you so much for your cooperation and making this happen, because I know what you all put into it. So have a wonderful evening and bye-bye. Thank you. Please register before you go. Thank you.
Thank you very much.
Hello, Prof.
1 minute. To our IT crew, please, our IT crew, thank you very much. Sorry, I was going to mention that. Thank you very much. Thank you.